of non-Hispanic whites had high school diplomas when they came around to counting Hispanics. And this is counting all Hispanics, not just Mexican-Americans, like our prominent numbers here. It was only about 60%. So it's not as scary as it used to be. It's still a whole third less almost than what the non-Hispanic white population has on us. When it came to bachelor's degrees, so going on to that next step, in that same year, just 2-3 years ago, only 12% of Hispanics, compared to 30% of non-Hispanic whites, had a bachelor's degree. There's 12 people in 100 and 30 in 100. I don't really like those numbers, but I do like that I'm included in that 12%, I would say. And again, my hope is that one day every single person in here will be included in those numbers and help bump it up and make it even. When it comes to minorities in medicine, that's a hot topic right now. Our new Surgeon General even mentioned in a recent, I think it was in November, when she first took office, that one of her primary goals was to help raise the numbers. Right now, African Americans and Hispanics combined make about 25% of the U.S. population, yet only 6% of the U.S. doctors in this country are made up from these communities. Latinos in medicine haven't grown at all in the last 100 years. We're still at about less than 6% in 100 years of all the doctors that there are in the United States. But the way that the Latino population is growing, we have the youngest kids, we have the highest groups under 18, and we are supposed to be 25% of the US population alone in the next 40 years. So if we don't start picking up, there's different people that are going to be looking at our patients. That's your parents, that's your grandparents, that's your children eventually. So with that, I just want to put this word in your mind, a homebred Hispanic doctor. What is that? And it eventually comes back to the difference between those students that I went to Notre Dame with that came from Cuba and Puerto Rico and Argentina and came here, did their thing and left, and if they decided they came back. But even they're different than what we consider ourselves. We're American, we're Mexican, we're a little mix of everything. And when my husband was filling out our census report, I asked him, he's like, what race did you mark me? I was like, well, I know I'm Chicana, or what do they tell you? You're Hispanic, if you're of other Latino origins, but then they still want you to pick that race. And I was like, well, they ask you if your race is white, if your race is black, or if you're Indian. And I was like, well, what if you're a mixture? That's our own thing. Again, you have to try to identify yourself, and you have to try to make people not fit you into that box. My box has kind of crossed over into multiple different spans of life that people probably don't usually put together. So it's, I guess it's kind of fun to switch back and forth between the two worlds and kind of try to make them all come closer together for me. I usually like to do PowerPoint presentations. Obviously, it's a little harder in a gym, but I have this map where in 2008, they drew out what the top 10 cities in the United States where Latinos are heavily concentrated. And again, this includes everybody, the Mexicans, Hispanics, of Cuban, Puerto Rican, and Central and South American backgrounds. But Chicago came in number 4, right behind Houston, which I think of Houston and I'm like, well, it's huge. We're not far behind. I live near San Diego now, and I feel like everywhere I go, everybody can say my name, Lourdes, not Lourdes, and they're number 9. We're actually bigger than San Diego here in Chicago, and I still consider myself a Chicagoan, even though I'm from Indiana, so I hope you guys don't mind that. But it's pretty amazing to me because living there, I do see the numbers. They're not hidden populations, and the doctors see them. And there's a huge, the hospital that I work in now, there's a ton of Latino doctors and a ton of Mexican doctors that speak the language and understand the culture. And yet Chicago's bigger, and I can't remember seeing too many of those same kind of doctors in the areas where I was training, where I was growing up. So again, those gaps need to be closed, and I am hoping to pull from you guys to close those gaps. I have a huge list that goes on and on about the disparities in healthcare. And again, I know that you guys have been preparing for the health fair back here, so I'm sure that you've heard these numbers before, where minorities across the board, whether it be HIV, diabetes, cancer, heart attacks, we just do so much worse than everybody. And again, Latinos, especially Mexican-American Latinos and African-Americans, are always at the bottom of those numbers. And no matter what way you jiggle around the data, it always shows up the same. Even if you take out, the educational attainment, even if you take out the socioeconomic status, if you're colored, you're not getting the same health care. And nobody can figure out why. They just keep getting the same data over and over. While some of the gaps are closing, there's still too many that are open. And I guess it's our job to push that extra mile and get in there and see if we can help close some of those. I want to throw in a little story because it kind of has to do with ways that we need to try to help our patients. When I was in the 6th grade, I told you how my dad always worked his 2 jobs and pulled 16 hours and was barely making ends meet. When I was in the 6th grade, he was hospitalized because his blood pressure was too high, and it was a near fatal, almost stroke situation was what his doctor told him. And what my dad remembers from that encounter is that this woman wants to starve me to death. Said, no more tortillas, no more tamales, no more anything fried. So what am I supposed to eat? She wants me to die. Thanks to her, he is still around, going on 80 now. And he's doing well. No strokes, no heart attacks. And he does still get his occasional tortilla and tamal. Once a year we all get our tamales. But I think that the important lesson from that is that although our doctor wasn't, anybody that even spoke Spanish, she understood what was important for my dad, and she knew what my dad was eating that was giving them his troubles, and she told him, maybe not in the most sensible way and sensitive way, but he got the message. And again, it's those little things that culture sensitivity, understanding what each person might be eating. She was Filipino. She was a family practice Filipino, but she saw all of our patients in East Chicago, and she knew what she was dealing with. She knew what she had to stop and what she had potential for stopping. Again, I feel that now when I see my patients on the floors and they've had their first heart attack, I can actually relate to that moment when they're having a life-changing event and they have to make those changes no matter what. It's a life-saving situation, basically. But I can kind of, tell them that story about my dad. Hey, he's living, another 30 years and he's doing all right. And that they can do it too without giving up too much of what is important to them. And that kind of leads me into another really important aspect of healthcare. It's preventative medicine. It's what healthcare reform is all about. If you guys have heard that buzz, I'm sure. Again, things that we eat, the lives that we lead, the stress that our families carry, especially being immigrants, having half of your family out there and half of the family here, they kind of forget about taking care of themselves, and it doesn't seem that anybody's too interested in remembering to help them. a lot of the studies from the national disparities, the Office of Minority Health has found over and over again that racial and ethnic minorities are less likely to get immunizations, both as children and as adults. They have higher chances of finding cancers that are too late to be helped. They're way later in stage. And heart disease, forget to tell them to stop smoking. Simple little things like that that could be the difference between a stroke or a heart attack. Makes it hard for these patients to want to go back to their doctors and trust them. Like I said, when I was in college, I volunteered in college, and then I volunteered here at Alivio Medical Center. I don't know how many of you guys are familiar with it. It's right over on Morgan. And I was there for a summer, and my job that year was to shadow, kind of learn to be a doctor. And I worked with a dietitian on a health initiative for diabetes. I know they have the annual Fiesta del Sol program here. And while I was living in Chicago or in the nearby area, I came back every year, and my poster was still being used, And I realized that I had been able to break things down in Spanish for the first time to the point where it was worth saving the poster. And it looked like a kid could have put it together. I'm not very artistic. After all, I was a science major. But, it got the message along, and it helped kind of demystify that really scary disease that so many of our Hispanic patients and African American patients are threatened by. Again, the numbers look just as bad for heart attacks, strokes. The complications of diabetes are always worse. People dying of cancer at such later stages, people getting AIDS, younger, going longer, not getting the right treatment for it. The care is always just not optimal. And a lot of times it comes down to insurance. And again, Hispanics have the highest number of uninsured rates of any of the U.S. minorities, racial groups. In 2007, that same study, they found that over 30% of the Hispanic population didn't have any insurance. The non-Hispanic white only had 10%. Still a lot, but we beat them by a whole 20%. So again, just some numbers that eventually do get boring, so I don't want to bore you with them. But I do just want to kind of focus on the cancer one, because like I said, we're a higher chance of being diagnosed with cancer at a later stage in life. When I was in medical school, I had one of my uncles on my dad's side. He was basically like a second father to us. He was diagnosed with mesothelioma. I don't know if anybody even knows or cares what that word means, but interestingly, I had just learned in my pathology class that it was actually one of the deadliest kind of cancers to be diagnosed. He never smoked a day in his life, and he was going to die of lung cancer. It was actually a cancer that he got because of the job that he led at doing brakes, and the place where he had worked his entire life had basically bought him his death sentence. Of course, my family was devastated. He was the healthiest guy, worked out every day, never smoked, and cared dearly for us, treated us like his own kids. And now he was going to die. He came to Loyola because he knew that I was there. And me being in the medical field, again, I was only in my second year of medical school. I don't know that I knew the top of my head from my behind yet, but at that time I knew more than my family. So I was designated as the official translator, and I pretty much went to every single doctor's visit with him and asked every single question he had, and his doctor painfully responded to each of them. And I remember we would start classes maybe about 8 or 9-ish, and I would go to the hospital about 7 and sit in his room, wait for the team to come around and just translate, because I knew that they wouldn't have the translator there for him. And there was one day he just couldn't poop, and he didn't know how to tell them. And so I told him, and I was like, this is my older uncle, and I'm telling them about his poop, But to him it meant a lot, He was able to tell them what he had to tell them through me. And again, although I didn't know what half of the stuff was that they were telling me, I knew that I could trust his doctors at Loyola because they were helping to educate me. And we convinced him to do an experimental chemotherapy. The drug that he was on bought him 9 months of life, and it's now used as a regular first-line treatment for cancers, you know, and thanks to a lot of the work that they were able to do from patients that volunteered to do it. He loved his oncologist, and, you know, she was one of those people that's available on the phone at night sometimes, and he would take advantage of that, poor thing.